There we go. I think I'm recording now so that I can post this and you can share this or rewatch it because it's a lot of information. But again, I am Kat. I am a doctor of physical therapy specializing in pelvic and women's health physical therapy. Pretty much everything pelvic floor related is my jam. Anything regarding pelvic health is something that I'm super passionate about. Like I just said, dealing with pelvic pain is something that I see super frequently clinically, and I get very passionate about because a lot of times individuals that I see have been to countless amounts of, providers and different office visits and just really haven't had answers. And we're sometimes the first person to put a lot of these pieces together and also give hope and healing because it does exist. So if you or anyone that you know is having pelvic pain, I just want you to know that yes, you are not alone, which I know is very cheesy. Everyone says that, but you really aren't. This is something that is very common, fortunately. But there's so much that we can do to help. And I hope that you feel that after today's webinar, you should have a lot of information to go with and feel a little more empowered. Okay. So what is pelvic pain? Kind of sounds like a weird question because I think it feels like it's intuitive, but it's not. So pelvic pain a lot of times is different depending on what we're talking about because the pelvis is a pretty large area. So pelvic pain really just means pain anywhere in the pelvis. So I'm going to go ahead and bring out my anatomy model. I use this thing a lot. Oh no, just lost a layer of muscles there. So anyway, this is the female pelvis, okay? This is the spine in the back here. This is the pubic bone in the front here. Anything in this region can be considered pelvic pain if you have pain anywhere in that area. So pelvic pain can actually feel like a lot of different things. So pelvic pain can be felt in the pelvic region, like I just talked about, in the lower abdomen, your lumbosacral area, which is your low back and your sacrum, your perineal area, which is around the vagina and rectum. In the vagina, in the rectum, pain can be felt in the buttocks or the glutes or the hips, in your bladder. It can go down the legs and your urethra, in your mid-back and thoracic spine. All of that can be related to pelvic pain. So chronic pelvic pain and pain with intercourse actually impacts up to 28% of women. That is a ton of individuals who are dealing with this. Chronic pelvic pain really refers to pain that's been around longer than 6 months. Many individuals who have pelvic pain have had this experience for a really long time. It's usually not like all of a sudden, unless it's from like an injury or a new disease process, et cetera. But typically pain has been around for at least a little bit in this area before we have answers. So these are, I'm not going to bore you with this and read them all off, but these are common pelvic pain conditions, kind of diagnoses that is common to have pelvic pain with. Very commonly endometriosis, vulvodynia, interstitial cystitis, a lot of painful periods. And a lot of these conditions can feel like it takes forever to get a diagnosis. And sometimes the diagnosis is, yes, important, but can also, a lot of similar things can be regarding the pelvic floor. So a lot of times we see pelvic floor muscle dysfunction in almost every single one of these diagnoses. So I like to just remind us that pelvic pain is multifactorial. So what do I mean? Pelvic pain has a lot of contributing factors to it. It is not usually just one little thing that's going on. Typically, it is a very multifactorial situation. And it's complex, but it doesn't mean that healing needs to be complex. It doesn't mean that your care needs to be complex, but there are a lot of factors and layers that can be contributing to pelvic pain, which is sometimes why it's so hard to diagnose properly. So how is the pelvic floor involved in pelvic pain? Well, I just read off all those diagnoses, excuse me. And I would say that in all those diagnoses, many individuals are experiencing pelvic floor muscle dysfunction. So let's go over the anatomy of the pelvic floor. If you've seen my videos in the past, excuse me, you will know that, I don't mean to bore you again, but I want you to really know what these pelvic floor muscles look like so that you can see and picture them inside your body. So pelvic floor muscles are muscles, just like the rest of your body, that were made up of a bunch of muscles in our body. And there's some that sit at the base of your pelvis, which are your pelvic floor muscles. So everything that you see in red in this anatomy model on here and in this bowl on the picture on the screen, excuse me, are pelvic floor muscles. So these muscles are super crucial to our day-to-day function. They actually have a lot of jobs. 4 of the main jobs include our bowel and bladder function due to sphincter control. So these muscles actually hold in your pee and poop. They also release your pee and poop, let you go to the bathroom. These muscles also support all of our pelvic organs that are in our bodies. These are the base basically of our center of gravity. They really need to be coordinated and functioning properly for nice, good support. They're also deep core stabilizers, meaning that they're a part of like your deep core and stability system. So when you do your day-to-day activities, these muscles need to function properly to give that nice stability and support. Lastly, these are very involved in sexual function. So these muscles are really related to pain with intercourse, difficulties or pain with orgasms or difficulty achieving orgasms, and many other things there. So these muscles rock. They're my favorite, clearly. But the pelvic floor muscles are usually involved in any sort of pelvic pain. But we really need to understand a little bit how pain works prior to really diving in to know more about pelvic pain, because pelvic pain is multifactorial. So knowing a little bit about pain can actually really help us understand what's going on. Now, there's a lot of different types of pain, but we're going to talk about commonly what happens when we have pelvic pain. So, a pain definition is basically that it's an unpleasant sensory and emotional experience associated with or resembling that associated with a actual or potential tissue damage. So that is what it's basically saying is pelvic pain, and pain is complex. And you see how it says actual or potential? So our body has the ability to feel pain, whether there's actual tissue damage or there's possibly the chance of tissue damage in a lot of other different ways. So just to simply put pain is an alarm system for our body. It's basically our body's system that is meant to alert us and say, hey, is this important? And then go away. So there is different types of pain: acute pain, which is like if I burn myself, I feel pain. And then there's more persistent or chronic pain that's lasted for a long period of time. Now, what we do know about pain is that if it's been around longer than around 3 to 6 months, a process in our body starts to occur that is called central sensitization in many individuals. And that is basically meaning that the nervous system basically becomes better and more sensitive to feeling pain. Now, I want to be very clear from the get-go. Pain is not in your head, but pain is created. It is created and produced by the brain. So basically, our brain is why we feel pain, but it's not in your head. You're not making up any pain. But the way, if I touch a hot stove or I prick my finger, a message goes up to my brain. And then basically my brain says, alert, this is painful, and sends pain back down to where I feel it on my finger. So your brain is what's actually causing that pain signal and any other sensation in your body. Now, when we've had pain for long periods of time, what the brain actually does is it kind of skips some steps and it can make you feel pain more easily. Or when there might be some familiar sort of pain happening, whether there's tissue damage or not. So what do I mean when I say tissue damage? So if you've ever like recalled a time where you've like woken up and there's been a bruise on your leg and you're like, where the heck did I get that from? I didn't feel that. That is a time where you damaged your tissues, but you did not feel pain. What the heck? What does that mean? How does that work? Well, it can also happen in the reverse. You can have pain without any tissue damage. And it doesn't mean, again, that it's in your head. It's just the way that the nervous system works. Our nervous system is constantly perceiving information and it's constantly trying to say like, what's going on? And what can happen when we've been in pain for a long period of time, the body kind of gets on high guard. It's like, no one come freaking mess with me. So what can happen is maybe things that maybe wouldn't have caused you pain recently really can actually cause you to have a pain flare or experience symptoms. Our nervous system is also responsible for many more things than just pain. It's processing a lot of information at all times: hormonal fluctuations, chemical fluctuations, sensory fluctuations, thoughts, all sorts of stuff. So sometimes when we have a lot going on in our personal lives, in our work lives, in our sleep schedule, and our hormones, all of that can put our nervous system into a high drive state, or what we kind of call our fight or flight state. This is called your sympathetic nervous system. What does this mean? This is a subconscious nervous system that basically is controlling if you're in a dangerous situation, typically if you're going to fight or flight, or basically neither. But in this in our society these days, we all kind of function in more of a fight or flight. Many of us do because of our lifestyle and what's kind of expected. So if we have pain and then we throw in our nervous system, kind of processing a lot of things, that can actually amplify our pain response. I'm spending a lot of time on this because pain science is a very, very important piece of any sort of painful condition. I could do a whole webinar on pain science. It is really hard just to like throw this out there. There's so many more details to it. But what I basically want you to take away is that pain is produced by the brain. It is not in your head that you're having pain, but we need to work on our nervous system to make sure that we are processing pain appropriately. That makes sense. Sorry if I lost anyone there. So anyway, I'm having pain. What the heck can I do to help? That's the most important thing, right? So for pelvic pain, these are several things that can be very, very helpful. So it's multifactorial. So pelvic floor physical therapy is one of the most indicated things if you're having any sort of pelvic pain that you should really, really seek out help for. Diaphragmatic breathing, which we are going to go through today, is very helpful. It's helpful for pelvic floor muscle relaxation, and also it stimulates your parasympathetic nervous system, which is your rest, digest, relax nervous system, which helps reduce pain. Mindfulness and meditation, for what I just said. Acupuncture can be super helpful, myofascial release and massage, craniosacral therapy, stretching and yoga, and medical interventions, any medications, injections, certain things can also be indicated. So let's break it up. Let's do some gentle exercises and some stretches, some things that you can actually do to help relax your pelvic floor muscles and help also reduce some pain. So I think I skipped over this when we talked about pelvic floor muscles, but a lot of times in pelvic pain, one of the main reasons that we're having symptoms is that our pelvic floor muscles are in a spasm. They are in a tight state. So let's think about our neck muscles. If my neck muscles are really, really tight, a lot of times I get neck pain, I get like jaw pain, maybe a headache, and they're really not working properly. So what do? We kind of work on stretching, relaxation, improving mobility. We do the same thing in the pelvic floor because a lot of times these muscles are way, 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 way too tight, and they're having a really hard time relaxing, and we're restricting blood flow. It's relating to a lot of times we're getting trigger points. Our nerves are getting agitated in this area, and it's usually due to tension in the pelvic floor and abdominal areas. Oftentimes also due to weakness. Lots of things can contribute here, but what I'm going to show you here are things that we can do to help facilitate pelvic floor muscle relaxation. So likely, if you're having pelvic pain, most likely, it's hard to know without doing a personal exam on you. And I don't know if your pelvic floor muscles are too tight, but really 9 times out of 10, if you are experiencing pelvic pain, a lot of times what we find upon examination is that your muscles are too tight. So the first step to healing is learning to relax them. So the things that we're going to do here are going to be pelvic floor muscle relaxation exercises, things that are really helpful to release tension here. I also will just give a little disclaimer. Everything I'm about to go through is just education. This is not medical advice. Please apply and use as needed. Seek out help from your medical provider for things specific to you. All right. Got to say it, guys. These days. Okay. So before we get going on the exercises, I want to show you some anatomy pictures because this is really important. So remember I said your pelvic floor is a piece of your core. So I want to show you, this is a side view picture. Down here, this little bowl here, that's your pelvic floor. Up here, this is a muscle called your diaphragm, really commonly talked about in singing and breathing and meditation, but it's the roof of your core. Your pelvic floor is like basically the floor. Then we have what's called our lumbar multifidus back here. It's one of the spine stabilizers. And then here we have our transverse abdominis. And all of these muscles must synchronize and work together for a proper functioning core and pelvic floor, and usually to have no pain or painful symptoms here. So we're going to do some exercises, and I really want you to picture this system and how important it is for these things to coordinate together. So we're going to go through diaphragmatic breathing first, okay? So diaphragmatic breathing basically is one of the best ways to relax your pelvic floor muscles due to pressure. And I'm going to show you a little bit here what I mean. Also, diaphragmatic breathing has many benefits to it, from cardiovascular benefits to sleep benefits to overall just health benefits, encouraging our rest and digest nervous system. But also it is really, I'm going to be selfish here, helpful to relax the pelvic floor because of pressure. So we have a pressure in our abdomen. So I'm going to show you here, our abdomen's here, right? So this is the diaphragm at the top. And then this picture doesn't have the pelvic floor in it, so I use this one over here. So the pelvic floor is in the bottom here, diaphragm's at the top, okay? So I'm going to kind of tilt the camera down and I'm going to show you why this is all, what the heck this all means. So your diaphragm sits like a dome at the top and your pelvic floor is like a bowl at the bottom. So when I breathe in, my diaphragm actually drops down and that increases pressure in my abdomen. When that pressure increases, my pelvic floor muscles must drop down and lengthen. So they get relaxed and stretched as I inhale. So the diaphragm drops down, pelvic floor muscles lengthen. As I exhale, diaphragm rises, pelvic floor muscles rise. They work in synchronization together, okay? So when we do diaphragmatic breathing, we are relaxing our pelvic floor muscles just due to anatomy, okay? So I'm gonna bring the model down. We're gonna go through this together. It can be helpful to do this lying down also, but sitting works fine. And it's really kind of hard to get the hang of it. So don't get discouraged. It's hard to learn via a webinar, but you can try it. There's also some really great YouTube videos on diaphragmatic breathing and just very, it can be one of the best things that you can do for your pelvic floor. So I want everyone to, if you're seated, stay seated. If you're lying down, cool. But I want everybody just to get really comfy. And if you're seated, get your feet flat, kind of separate your sit bones. And I want you to think about your ribs, okay? So you feel where your ribs are, right? Now I also want you to feel where your pants button or tie. Okay, so that's kind of like the abdominal part. This is the rib part. So when we do diaphragmatic breathing, what we don't want to do is use our chest or neck muscles to breathe, which is how many of us breathe. So this is going to feel weird or confusing to many people. So what you want to do is, as when you breathe in, we're going to breathe in slowly, maybe to like the count of 4. I want you to picture your ribs going out and your belly going out, almost like 360 degrees breathing. You're breathing out in your ribs and you're out in your abdomen. Your chest is not rising. You're not using this. You're not just poking out your belly. Okay. So the best way that I find to help is if you bring your own hands to your ribs and relax those shoulders down. Okay. Now I want you have your hands on your ribs. Let's just try one focus on the ribs. So I want you to take a nice deep breath in through your nose. Thinking about you're going to push your hands out with your breath. Take a breath in and out. Very good. Now I want you to think about that area where your pants tie and the ribs at the same time. As you breathe in, I want you to think about both expanding. Let's do a few. As I breathe in, ribs expand, belly expands, and out. Good. Let's do 2 more. Releasing as we breathe in, exhale. So as I breathe in, ribs go out, belly goes out, inhale, exhale, let it go. Good. So practice this. It takes practice, but really the main things I find it's helpful to look in the mirror when you do this. You don't want to see your chest rising up or just your belly poking out. You really want to think about those ribs and everything expanding. That is true diaphragmatic breathing. Now, there are, like I said, other tutorials on this online. You can go down quite the rabbit hole and look at diaphragmatic breathing, but the main purpose is to help with pelvic floor relaxation if you're dealing with pelvic pain. All right, so the next step is pelvic floor muscle relaxation. The nice thing about this is it's the same thing we just did. We're just going to shift our focus to a different area. If you're sitting, it can be, if you're lying down, it can be harder to feel. So sitting, sometimes it's easier to feel this, or if you can like roll up a towel and sit on that, that really, really helps. Or also if you kind of bring your knees to your chest, if you're lying down, you can typically feel this a little bit more. But basically what I want you to sense when we do that diaphragmatic breath, I want you to feel the area between your sit bones. So these are your sit bones. So think about vaginal rectal area. So when you take that breath in, you might feel how it drops down a little bit here, very subtly, and expands. That's pelvic floor muscle relaxation. So let's try it together. So same thing we just did. You're going to do a diaphragmatic breath in, but I just want you to focus on that area between your sit bones, your rectal and vaginal area. So I want you to take a nice deep breath in and see if when you inhale, if you can feel that downward movement or increase in pressure near your rectum and vagina. If you can feel that, that is pelvic floor muscle relaxation. This is also very challenging to feel. So don't get discouraged. It takes practice, and know that if you're doing diaphragmatic breathing properly, you're also relaxing your pelvic floor just due to anatomy. That's just how it works. Okay. So that's pelvic floor muscle relaxation through diaphragmatic breathing. This also has many benefits to our pain processing and everything like that. Okay. So we're going to go through a few other of my favorite stretches for pelvic pain and pelvic floor muscle relaxation. So I'm going to go ahead and tilt the camera down. We're going to come onto the mat here and just bear with me. Okay. You can watch this on the replay. I'll send you a link to it. Okay. Now, my favorite stretch is called Happy Baby. So if you've done yoga before, congrats, you know Happy Baby, but I like to do it modified. So you're going to lie on your back. And I like you to bring one leg up at a time behind your knees. And I just like you to let your legs flop and relax, bringing your knees towards your chest and whatever feels comfortable. And you can just lay here like this and take about 5 to 10 deep breaths. And you should feel as you inhale, the pelvic floor muscles really relaxing. Some people like to take Happy Baby to here, all the way to the feet, or just behind. I like just on the knees. You can also put your feet up on a wall and breathe there. So that's Happy Baby, which can be super, super helpful. Another great stretch is to stretch your glute muscles. So you can bring one foot over to the opposite ankle, bring your hands, wrap it through the leg, and pull on up to a figure 4 stretch. This is a great one. I'm going to show you on the other side. So ankle comes to above knee. Hands reach through the leg to the other side and gently pull. Some people feel a stretch just sitting here. That's okay. If you want a deeper stretch, bringing the knee towards the chest. You can also put your foot on a wall and do this stretch here. Really nice for the glutes. Another stretch is a butterfly stretch. So keeping your feet and knees together and then slowly letting your knees and feet kind of fall apart and feeling a nice stretch in your inner thighs. This is a really helpful stretch. If this is too much, you can certainly put pillows underneath your knees to help support, and breathe here for 5 to 10 deep breaths. Other few that I really like are child's pose. So very similar to what we just did. So on your hands and knees, bring your toes together, knees apart, sit back on your feet, walk your hands forward, and take 5 to 10 deep breaths here. You can also keep your knees together if that feels better. That works too. So those would be my favorite ones to jump to. There are many more, but pretty much any sort of stretch for your hip or hip musculature around it can be very helpful for the pelvic floor. Oftentimes even, just any sort of back kind of mobility, hip mobility can all be helpful for pelvic pain. But those are kind of my favorite ones. So Happy Baby, so our knees towards our chest, sitting there doing the figure 4 for our glutes, also the butterfly stretch, and then child's pose. Those are some really great ones. There are, like I said, are many more. And I think I even have a post on my Instagram about some that you can do as well. Oh, I'm out of breath. Hope that was helpful. Yes. Okay. So let's talk a little bit about so we're going to go through a lot of physical therapy type interventions for pelvic pain. So I'm going to just give a little pre-warning. We're going to talk about some things that look like intimate toys, okay? But they are actually used for self-myofascial release and self-desensitization. Now, I will say that these are best done under the guidance of a pelvic floor physical therapist. This is the best way that you know that's what you actually need and to spend your money on, and also to make sure that you're doing it properly. We actually practice this in session with you, but I like you to know what's out there because these can be very helpful, especially if you are somebody who doesn't have a pelvic floor physical therapist within like hours of you. These can be pretty helpful. Also recommend doing like an online consult with someone too, just so that you're not out there in the dark. I do love the brand Intimate Rose. She's actually a pelvic PT. Her name's Amanda Olson. She created a lot of these products. And she also does have informational videos on her website as well. I do also have a coupon code. Honestly, though, there's another brand called Therawand that works great too. It's plastic. These are silicone. So I'm going to kind of show it to you and what the purpose is. So just bear with me. So this is a Therawand, or excuse me, a pelvic wand. And this is basically a self-stretching tool for you to stretch your muscles. So you know how there's like the Theracane for the back to get to those trigger points and those knots? Well, this is one for your pelvic floor muscles, okay? So basically what we do with this is we teach you how to stretch, ooh, this is hard with the camera, your own pelvic floor muscles. Like I said, there's a reason this is best done with a pelvic floor therapist, because we want to make sure that these muscles need stretching first, and also that it's not too intimidating for you to do. Some people are like, I am never going to do this, lady. It's freaking me out. Don't worry. It is not 100% necessary. It's just something that is out there. Okay. So I like to know, like, I think everyone should know what's out there. So these are really helpful for stretching your own muscles, releasing trigger points and tightness in the muscle. That's a wand. Now, there's these other things called dilators. So if you're having pain with, insertion or deep penetration, and feeling like, a lot of like sensitivity with insertion, especially, dilators can be super helpful. So they look like little toys here, but they go up in sizes. So what you can see, how you guys doing? Okay. What you can see is that they increase in diameter. And basically what we're doing when we're using these dilators is that we're helping the body gently stretch the tissues and learn on perceiving if a stimulus is painful or not. We're working on our nervous system and desensitization. Really, really, really recommend seeing a pelvic floor therapist. Again, I know I sound like a broken record. I just don't like giving like random advice to someone I haven't really assessed, but these can be super helpful in your healing journey, especially if like OB exams are really painful, or you're really fearful of a OB exam, or inserting tampons is painful, sexual activity is painful. These can be really, really helpful. Okay, mindfulness and meditation. So this is actually very scientifically proven to help our pain processing improve, and can be very helpful in overcoming pelvic pain as a piece of the puzzle. So mindfulness and meditation kind of go hand in hand, but they are different. Mindfulness is a little bit more, being present in the moment, feeling like the sensation on your skin, the being in touch and tune with the exact moment. Meditation is also more of a meditative state where we are in a deep relaxation and kind of Zen thought process. I really like the app Insight Timer. It is free, and there's guided meditations from 1 minute all the way up to hours long. It's called Insight Timer. Also, the Calm app can be really helpful for some people. I do think you have to pay for that one though. But meditation and mindfulness is super important, especially when we're dealing with pelvic pain. It helps down regulate and control our nervous system from being more in that fight or flight state, which can really help improve pain. Now, that does not mean it's in your head. Just means that these things help calm our nervous system a little bit. Okay. So like I said, it's multifactorial. So your care team and different strategies. So I like to kind of say like it's an integrative approach to healing pelvic pain. So you have pelvic floor PT, which I really like highly encourage you, if you have any pelvic pain, to see a pelvic floor physical therapist, specifically probably somebody that really sees pelvic pain frequently. It can be, I usually like to ask if therapists, if I'm going to see one, if they both do internal vaginal and rectal pelvic exams. That's usually how you know if they actually have enough of the training to see pelvic pain. Also, your physician can be very helpful with medications management. Other alternative kind of medical management is acupuncture, chiropractic can help, massage can be very helpful, nutrition can be helpful, mindfulness, meditation, yoga, exercising, actually exercise, even up to 10 minutes of just walking or things a day can actually chemically change some things in our blood flow that can make us feel less pain. Very, very important for overcoming pain. Obviously, if you're in too much pain, exercise, that's where we can come in, help you get back to participating. Also, making sure that you have, emotional support. A lot of pelvic pain, unfortunately, we do see a lot of individuals who have experienced, sexual trauma or unwanted sexual experience, or just trauma in general. Oftentimes, our pelvic area is a very common place. There's actually studies where they showed individuals like pictures of very like horrific things, and the first place to contract was their pelvic floor. So it is very innate for us to hold tension here, especially when we've gone through some really tough life events or are dealing with some tough things. So counseling, also if you're having pain with intercourse, sex therapy can be like, it's actually, I usually say like it's like pelvic PT, sex therapy, all the things. It can be just the best thing for you. Stress management. So we kind of talked a little bit about stress. So I always just like to make sure that you know that your stress is not causing your pelvic pain. But if you are having a more stressed lifestyle, if you are not having good sleep, if you are kind of running on E, that can cause your nervous system to feel pain more easily and amplify the pain response. So helping to reduce some stress or stress management, good coping strategies, can be very, very helpful. Good sleep hygiene. So sleep is a very common thing that we kind of just brush over, like, yeah, I know I should sleep, but actually sleep is a very imperative time that our body heals, rests, regenerates, and deals with our pain signaling. So ensuring that you're having a good sleep. So good sleep hygiene, some things that include are basically not using like watching TV, you're on your phone like an hour before bed. Don't take a hot shower right before bed. Try to, read something boring, not something invigorating, and try to do things where you can actually fall asleep and stay asleep and get really good rest. So a lot of this is integrative because our bodies are very complex and pain is very complex. But the best way to know is to get an assessment for you. So like I just said, how do you know what's best for you in your pain? Reach out to your medical providers and schedule a pelvic PT eval. That is how we know what's really appropriate for you. These webinars can be super helpful because it's like just general information, but I want every person who's joined us tonight, if they are dealing with pelvic pain themselves or maybe know somebody who are, to know that it really does take an individualized approach to care. And I hope that you will do that for yourself and get that specific care for you. So other symptoms of pelvic floor muscle dysfunction, I just like to throw this out here because a lot of times these things are also happening in conjunction with pelvic pain. And it makes sense because these muscles have a lot of jobs. So when they're not working properly and they're causing pain, a lot of times they're causing these things too. So any sort of leaking, even one drop, or full loss of urine, gas, or stool, difficulty with bowel movements or urination, feels like you can't get it all out, you can't start the stream, or it feels like it's really hard, you have to strain, any constipation, any sort of pain during urination or bowel movements, feeling like you can't pee or start the stream, like I said, so that's your retention. Prolapse or heaviness in the pelvis, overactive bladder, urgencies, frequencies, non-resolving low back and hip pain. A lot of times pelvic floor is very much a piece of this, and many more things. So if you're wondering if pelvic floor physical therapy is appropriate for you, send me a message. We can talk it through. I will let you know honestly, like, oh, you need to do this. Also, if you are having pelvic pain too, I always do kind of encourage you to have your medical provider on board to make sure there's no infections or any other underlying disease processes. A pelvic floor physical therapist can also, if they see you, we can also make usually a good recommendation if we do see something that seems more abnormal to send you back to the right appropriate medical provider. But always great to have a good team here. Okay. Just blabbed for a solid 36 minutes. So thanks for bearing with me. I know I talked at light speed too. So hope you guys caught all that. I'm going to go ahead and open the chat and we can do a live Q&A, no pressure if there's no questions. But I would just like, to take a few moments to answer any, if you had any. I know we covered a lot, but does anyone have any specific questions? And then I'll get to where you can contact me in just a moment if you do have any questions or want to make an appointment or are just wondering more about pelvic PT. Also, I know many of you who are joining are actually not local. So I am super passionate about making sure that somebody is seeing the appropriate provider. Unfortunately, the way things is, oh, thank you. I'm so glad. I'm so happy that you found it helpful. I just want everyone to know though, that unfortunately, there is not any sort of legal reasons why someone can't say they are a pelvic floor therapist and not actually be. So it can be marketed. And I just really want individuals who are experiencing anything like this to make sure they are going to a true specialist and a true somebody who truly sees this every day. A lot of times there's no malintent in it, but it just, when you're dealing with pelvic pain, typically it's pretty complex and you really want a true specialist to see you. So I am more than happy to help you find that person. Typically, like I said, some good screening protocols to do is to ask if that therapist does internal vaginal and rectal exams. Also, just seeing if you can get that therapist on the phone, making sure it's a great connection. That's really important. This is like private stuff. So you really want to make sure that you feel comfortable. And make sure that you feel like you can trust this person. And if you go to the eval and you don't feel a good vibe, just keep shopping around. We are becoming more and more available, thank goodness. And it's just really important that you find the right provider. But it's not weird to call and ask these questions. We are so used as pelvic floor therapists to getting tough questions, and we talk about all the things no one wants to talk about. So it's totally fine to call us and ask. And yeah, the more informed you are, the better. But I hope that, yeah, if you have no other questions, that's totally fine. I'm glad that you guys found this helpful. And I will be posting this replay to our YouTube channel. If you have any friends or family, or you want to rewatch some of the information we went through, because we went through a lot, I know. So I'll just give it another minute or so. I really appreciate you guys. All right, I'm just going to switch to the next screen just in case. Oh, you're so welcome. So kind. You guys always fill me up, I swear. So I love this. I love what I do so much. All right. So if you have questions or want to make an appointment or anything, here is my number. You can also email me here. You can contact me on Instagram, Facebook, whatever you need. Also, our website, there is contact form there. Happy to help however I can, whether that's with me or somebody else in your area. I'm just really passionate in making sure you find the right care that you need. So just keep me posted. Thank you all for joining. I hope you have a beautiful night. And I will see you guys in the next webinar. Thank you. Thanks so much. All right. Bye, guys. Oops.